Well, one of the things I think that the pandemic showed us is the value of the laboratory community. And I think that that's something that we've always tried to convey to the rest of the medical community and to the public at large. This really made it tangible in a very important way. The public could see that testing was required for the kinds of responses that needed to happen during the pandemic. And what I'd like to do during my presidency is to continue to advocate for us, to continue to show the value of lab medicine more broadly, even beyond COVID-19 testing, and the way that we are so integral to the entire medical system. Certainly the first important step has already occurred, which is that the lab has started to come into the public consciousness, again through the COVID-19 pandemic. My predecessor, David Grenache, has already started a committee to look at the value of lab medicine and the ways in which we can specifically continue to advocate for our field in terms of not only the medical value that we bring, but also the economic value. So I think that supporting that committee and the work that's going on within other parts of AACC, including the AACC Academy, will be an important set of steps to really bring this forward. One of the big things that I'm very interested in is the role of data analytics in laboratory medicine. And as you know, it's part of our strategic plan. I think that we are the people who are in the position to make best use of data analytics with laboratory data. We understand the data, we know where it comes from, we understand the implications of it, so we should be the ones driving the use of it. I think that one of the things that AACC can do is to provide education for our members and other opportunities for all our members to understand the use of data analytics to make appropriate use of the data that we generate. Of course, data analytics is a very broad term, and in our view, it encompasses everything from operational use of data through advanced machine learning to improve diagnostic accuracy. And I think that all of these things are things that AACC can become a part of and that we as a field can drive into the future. Our charge is to support laboratory medicine in service of healthcare. And the way we do that is to recruit the very best, most innovative, most diverse group into laboratory medicine. That's how we will be successful in the long term. So we can't afford to have any artificial barriers that keep anyone from being excluded from what we're doing. We want to make sure that we do our very best to ensure that everyone is able to contribute to the success of laboratory medicine as a discipline in the future. There's no question that the last now almost 2 years of the pandemic have been a real challenge for the laboratory medicine community. We've had issues with personnel, we've had supply chain issues, we've been required to bring up new tests, and it's all been under a microscope with the focus of the world on the laboratory medicine community. Yet we have risen to this challenge, we've persevered. I know we're all tired at this point, but I think the thing that we can take real comfort in is that we have risen to the challenge. We have publicly shown the value of laboratory medicine. We're not just off in the basement. We are front and center in terms of public health and in helping the world to address a serious, once-in-a-century crisis. I know I'm proud to represent this community. It's amazing what we've accomplished during this time. I hope that you also share in that pride in the laboratory medicine community and what it is that we've done.